So, we know that cancer is a nasty disease, but luckily there are some treatment strategies that can work for some patients, whereas unfortunately not for others. These include local treatments such as surgery, which is indeed the oldest form of cancer treatment, but other forms involve radiation therapy, where small breaks in the DNA inside cancer cells can be made by using high energy particles. And then we have systemic drug treatments because they can affect the entire body, and these include chemotherapy, immunotherapy, targeted therapy. Chemotherapy consists of a cocktail of different drugs that work together to stop reproduction and prevent cancer growth. However, targeted therapy, immunotherapy, and hormone therapy are actually therapeutic approaches that partake in precision cancer medicine. And lastly, stem cell or bone marrow transplant, which involves replacing unhealthy cancerable blood cells with healthy stem cells from the blood or bone marrow, and is actually a treatment particularly successful in blood cancer, such as leukemia. Now let's look a little closer into the targeted therapy, as it is largely part of precision cancer medicine. So, what targeted cancer drugs do is that they bind to a specific surface marker in cancer cells. For example, a changed protein, a newly expressed protein, or overexpressed protein, resulting from the genetic changes in cancer cells that we mentioned before. However, these drugs will not bind to cells that do not express such a surface marker, which will ideally be the normal cells. Hence, these drugs are aimed to be more concentrated near cancer cells, causing fewer side effects than traditional non-targeted drugs such as chemotherapy, hence contributing to a more specific therapeutic approach. So, among all the previously mentioned cancer treatments, precision cancer medicine allows for a more precise, safer, and a more effective treatment. We have already talked about ways genes and gene changes can affect cancer risk and even lead to cancer. So with such understanding of cancer biology, we can translate this evolving knowledge for the clinical benefit of patients. In other words, we can evaluate the genetic characteristic of a patient's tumor. For example, certain gene mutations that are common in some cancer types can be helpful in diagnosing a cancer, in detecting certain cancer types early, in preventing some of the cancer types and evaluating the development risk, or even that can help in monitoring the effects of a treatment, or based on those changes in the genes, the doctors can decide on the best treatment option or even learn about the prognosis of a patient. So, when thinking about precision medicine, understanding gene mutations and how they can affect a person's risk for cancer or treatment for cancer is important. Depending on the type of mutation, an abnormal gene change might make a person more likely to develop a certain cancer. Or, if they already have cancer, the abnormal gene might mean that the cancer may or may not respond well to a certain treatment. In some people with cancer, a specific gene mutation might mean that their prognosis is better or worse than someone with the same cancer who does not have that gene change. For example, when a person is diagnosed with cancer, they often get the same treatment as other people with the same type of cancer, let's say in the lung. But gene changes might be different, even if those patients have the same type of cancer. So the involvement of such different genetic changes means that cancer genome can differ among patients, and that is also known as interpatient tumor heterogeneity. So two patients with the same tumor subtype behave different clinically because of different genetic mutations. And we can think of this as an analogy. For example, the piano keyboard. It has different keys, and you can make multiple different songs by combining them in different ways. Similarly, the cell has different genes which can be changed, and different combinations of those changes, of those mutations, can be achieved in each individual tumor, though it might be affecting the same organ. Because of this, each of those people might have a different response to the same drug. So for certain cancer types, doctors will test for gene changes that can tell them if a person might respond better to one drug, and that drug will be used to treat a patient that has cancer with those genetic changes, which is the main idea of precision cancer medicine.